Hello, these are Flipped Notes 8-5 of Clinical Psychology, and we're looking at neurodevelopmental disorders. Let's get right to it. So, neurodevelopmental disorders all have in common that they are usually diagnosed during childhood, infancy, or adolescence, and they all involve some type of distortion involving social skills, language, perception, or motor behavior. You've probably heard of most of these, so let's get into it. Our first one is autism spectrum disorders. Recently, several of the disorders that were part of autism have all been kind of gathered under the umbrella of autism spectrum disorders, including other ones you may have heard of, like Asperger's or Rett's disorder. But with all of these, there's an unusual pattern of social and cognitive development that starts in childhood with lots of difficulties in social interaction and communication. There's quite a range from lowest functioning to those who are very high functioning with characteristics of autism. The new diagnostic criteria of the DSM divides autism characteristics into two categories: social communication, interaction, and restricted and repetitive behaviors. The onset of autism is usually before the age of 3, a lot of times much earlier. And research shown that if it's caught earlier, there may be more success in treatment. Autism does seem to show up more frequently in males, 4 to 5 times more in males than in females. And about 70% of those with autism also have an intellectual disability, but that's 30% who do not have that disability. Other characteristics of autism: impairment in social relationships. So often a very lack of awareness of existence of others' feelings or an ability to show them as well sometimes. They may not like to be touched or held. So some sensory issues. They often avoid eye contact and prefer solitary play. They're about half of autistic children do not develop speech, and they have this impaired speech, or it's very delayed. Speech often is like an echo of what is heard, so not original words. A very narrow range of interests and activities. They may focus on objects almost obsessively. And sameness and routine is very important, that they often become very distraught or angry, especially the younger they are, if change occurs. Many of them engage in self-soothing behaviors to block out sensory information. Sometimes it's rocking. Sometimes they may actually kind of hit themselves, spinning. There's a variety. They do not seem to have the filter that blocks out irrelevant info. And so they don't have selective attention, so they can be overly stimulated very easily. The causes of autism, there's a range from both genetic and environment seem to play a role. They've identified a number of genes associated with the disorder. Studies of people with autism have found irregularities in several regions of the brain, including abnormal levels of serotonin or other neurotransmitters in the brain. And then people have had their suspicions that vaccines may have played a role in the onset of autism in children, but numerous studies have been done finding that there's not a link between receiving vaccines and developing autism. Our next disorder in this category is attention deficit hyperactivity disorder, or more commonly known as ADHD. With this developmental disability, there's a short attention span, distractibility, extreme difficulty in remaining inactive or being still for any period. Seems to affect some 3 to 5% of school-aged children, and we've got 3 subtypes, which I don't think you need to really try to memorize the different types. But there are predominantly hyperactive, impulsive, predominantly inattentive, and combined hyperactive, impulsive, and inattentive. And the titles there are really kind of self-explanatory, but let's go through them a little bit more here. With inattention, they're very easily distracted. They tend to miss details, forget things. They want to switch from one activity to another very often, but very difficulty focusing on one thing, hence the name inattention. Tend to become bored with a task after only a few minutes, unless they're doing something that's really enjoyable to them. Have a hard time organizing and completing a task or learning something new. Have trouble completing or turning in homework assignments, often losing things needed to complete tasks or activities. You can see how ADHD can really be dysfunctional when it comes to school. Other things with inattention: they have trouble completing or turning in work, often may not seem to listen when they're spoke to. They can be in la la land, daydreaming, easily confused. Sometimes they move slowly. And then they have difficulty processing information as quickly and accurately as others. They struggle to follow instructions. The second type with hyperactivity, they fidget and squirm in their seats, talk nonstop, dash around. As it sounds, they're hyperactive. Trouble sitting still during dinner, school, story time, any time where they're expected to sit still, want to constantly be in motion, have difficulty doing quiet tasks or activities. And the third one, impulsivity, be very impatient. They might blurt out inappropriate comments. They're impulsive. They show their emotions without restraint, act without regard, difficulty waiting for things they want or waiting their turn in games, and they often interrupt conversations. So if you're asked about ADHD on the AP exam, I don't think they're going to get specific about the three categories, but you do want to recognize all those different symptoms. What are the causes of ADHD? Research points to also, like autism, a combination of both genetic and environmental factors. Treatment often involves administering stimulant drugs like Adderall, Ritalin, and they seem to definitely improve the symptoms. They often have a calming effect, but sometimes they have adverse side effects. Individuals with ADHD may have other disorders such as a learning disability, oppositional defiant disorder, conduct, anxiety disorders, depression, bipolar. Any one of those does not cause the other, but the symptoms of one may make the other one more noticeable or severe. Our next one, and we talked about this a little bit in a previous section, is oppositional defiant disorder. The behavior here usually starts by age 8, but it may start as early as preschool years. To be diagnosed, the symptoms must last for at least 6 months and be more than what a normal child would have when it comes to misbehavior. They're not following adults' requests. They can become angry and resentful. They argue with adults, blame others for their own mistakes. They tend to have few or no friends or have lost friends, and that's part of that dysfunctional inability to form relationships. Constant trouble in school, loses their temper, spiteful or seeks revenge, touchy or easily annoyed. Remember, we talked about that children can't be diagnosed with personality disorders. So, personality disorders are not diagnosed till 18 or older. So, this would be sort of the childhood version of a personality disorder. The pattern of behavior has to be different from those of other children around the same age developmentally, and it seems to be caused also by a combination of biological, psychological, and social factors. Our next one, which we also talked about a little bit previously in the personality disorder section, is conduct disorder. It has been associated as a result of child abuse and family conflicts, genetic defects, sometimes poverty, parental drug addiction, or alcoholism. And this one also seems to be more common among boys. They tend to be impulsive, difficult to control, and also unconcerned about the feelings of others. In the previous section, we said that this is basically the childhood version of antisocial personality disorder. There are antisocial behaviors there, including bullying and fighting, breaking the rules for no reason, cruel and aggressive behavior, fights, sometimes forced sexual activity, destruction of property, even getting into drinking and drug use, lying, running away once they get older, truancy, so skipping school, and vandalism. Children with conduct disorder may go on to develop personality disorders as adults, specifically antisocial personality disorder. And if their behaviors worsen, these individuals may also develop significant drug and legal problems. All right, that's it for our neurodevelopmental disorders and 8-5 flipped notes.